Hello, everyone. I'm Lawrence Lee. I'm one of the colorectal fellows over at Florida Hospital right now. So Dr. Monson was supposed to be giving this talk, but unfortunately he had a family emergency, wasn't able to make it. I've nevertheless left his name on here to spread some of the blame in case you guys don't really particularly agree with what I'm saying. So just keep that in mind. So this is a disclosure slide. Dr. Monson is a consultant for TWISTLE, which I'll talk a little bit about. I myself, unfortunately, have not yet gotten any disclosures. Today, we will talk some about what exactly is patient engagement, why does it matter, and the bulk of the talk will be, can apps improve patient engagement, and finally, we'll touch a little bit on what are the barriers to implementation. And kind of some of the people have already mentioned the barriers of Epic. We use Cerner and have kind of run into a lot of the same buzzsaw issues. So what exactly is patient engagement? So several definitions. The one I like the most: actions individuals must take to obtain the greatest benefit from the healthcare services available to them. And some of this, you have to differentiate a little bit between patient engagement, which is active involvement, and patient compliance, which is really a much more passive role where the patients just do what you tell them, versus engagement is where patients will go out and seek and try to find, get the most bang for their buck. And overall, I think most healthcare providers will agree that they feel that there are very few highly engaged patients. And what this means is that most of the time, patients will just kind of do what you tell them and at best, but very few of them actually are actively involved in their care. There's different ways of measuring patient engagement. In this case, they're calling it the patient activation measure, very similar. Level 1, 2, 3, 4, and this is based on 4 very simple questions. And you see the large majority of people fall somewhere between level 2 and level 3. So level 1 being completely passive, my doctor is in charge of my health care and I will do whatever he tells me. Level 4 being I'm my own advocate. And most people fall somewhere in between. All right. And so the New England Journal of Medicine had a recent workshop on a lot of this on patient engagement, and a lot of this data comes from them. And they found that one of the biggest challenges in improving health outcomes for your patients, you see here, is the second is about half of them felt that there were very low rates of patient engagement. This is not working. Okay. So and there are studies that show that patient engagement or highly engaged patients really do much better. Here, population-based study in several counties in Minnesota, they show, and this is from the patient activation measure that I showed before, so level 4 would be the most highly engaged patients. You can see here that compared to level 1, 2, 3, highly engaged patients had higher rates of getting screening for colon cancer, cervical cancer, breast cancer, had less unhealthy behaviors, had a higher percentage of them had normal ranges of blood pressure, HDL, triglycerides, and as well had much fewer visits to their healthcare providers. And as well, when you look at the cost impact of this, you can see that highly engaged patients actually, somewhat counterintuitively in my mind, is that they actually have much less costs associated with them. So now that I've shown some of the data as why patient engagement is important, we'll talk about, do we think that apps or mobile health can improve patient engagement? Here are some of the things, again, from the New England Journal Catalyst survey. What are the top 2 initiatives that are most effective at improving patient engagement? So 1, have physician, nurses, or clinicians spend more time with the patient. So we kind of know that that's most of the time not possible. Shared decision-making, and make it easier for patients to access relevant health services. So actually, mobile health or apps really can help with these top 3 things. We know that almost everybody, and I think everyone in this room will agree, that pretty much everyone has some sort of a mobile device. And so of the people who have some sort of a smart device, 62% of them within the last year have used it to get information on some sort of health condition. And as well, not only mobile phones, but as well there are more and more people who are starting to have a tablet. The use of desktops kind of have been around 3/4, and as well in some tablets and e-readers have grown significantly over the last couple of years, showing that people have the possibility of having, not needing to be stuck at a computer to look at these things anymore. When we look at some of the traditional ways of engaging patients, so traditional having calling to someone's landline, snail mail, patient portals, paper forms, inpatient visits, the whole mobile health revolution has gone towards going, we're going to call your mobile phone, we're going to send you emails, we're going to have mobile engagement, which is apps. We'll talk a little about wearables integration. This is a lot of the activity trackers and asynchronous visits, meaning that a lot of this is actually done not in person. Some of the possible applications for certain, this is my pun that I'm particularly proud about. When we look at before surgery, so what can some of these apps do? Enhance decision-making process and streamlining informed consent. We all know very well that when you talk about a surgery about two patients and you're giving them informed consent, they retain very, very little, if any of it. We can deliver information on the procedure and expected perioperative course and recovery. We can as well streamline some of the admission processes. And after surgery, these apps can deliver individualized postoperative care plans, more effective discharge planning, and optimizing rehab and follow-up. So it's interesting that this is actually published, but basically a systematic review of all of the available apps, and within most of them are in general surgery and in plastic surgery. And by and large, most of them are for Apple and not Android. So if you have a Google Nexus, you're kind of, screwed a bit. But we know now this is growing exponentially in terms of the apps for healthcare-related apps. There are now over 165,000 of them. Several of the ones that are specifically targeted for patient engagement. You can see some of them that are here. I'll talk mostly about TWISTLE, as that's where we have the most experience. And this is a specific app that allows for secure messaging automation. It's very easy to set up. It's super customizable, and you can configure it to whatever you really want to put in there. And there's some EMR integration, although depending on which one you have, it's easier said than done sometimes. And this is a bit of an example of what we really mean, what we're using TWISTLE for. So in the sense of for someone with some type of digestive disease, so if you have patients who haven't had a colonoscopy, it gives them some sort of robocall, text message, and it gives them a link or displays information on their app about education of colon health. You go all the way down patients who need chemotherapy. Again, reminders, mobile reminders using within app, or the app itself will call the patient to give them reminders to go to their chemotherapy, and the reasons why they need to go. There are several commercially available ones. There is the possibility of developing your own. This is data from the Mayo Clinic showing, this is an example of their own app that they've used. This is one that they've developed. They've put it on, and they give their patients iPads while they're in hospital, and this is preloaded, and this is what they use. So this is just an example of kind of how these can be useful. So this is the daily care plan. You can see, so this is day 2. This is specific in thoracic surgery, but so this is the patient will expect that their urinary catheter and their chest tubes will be out today, and what they need to do, gain strength, and this will, if you click on them, they'll say, this is what you need to get out of bed, you need to you need to get out of bed, and things like that. And this is the instrument that the patients will fill out. So not only is it something that you can provide education and daily milestones for, this is in terms of research or data collection, the patients are doing it for you, so somewhat useful. And as well, when you look at the compliance, really day 1 and 2 is where the highest, and as it kind of falls off between days 4 and 5 and 6. But really, within, and their explanation within this paper is they said that by and large, most patients without complications are leaving by around day 3. So the patients that are left over on day 4 and 5 are the ones that are complicated, and it's hard to fill out an app when you're intubated in the ICU. So, and by and large, most healthcare providers do think that these patient engagement tools are helpful. You can see here that in terms of the lighter is does improving patient engagement improve quality, and does it decrease cost? So by and large, most people feel that it does improve quality and it does decrease cost, but still there are a lot of healthcare providers who don't know. When you look at when you look at the available data, and this is where a lot of people have reticence about adopting these things as well, is that they're not sure if they work. 26 total studies, and of some type of mobile health intervention, and of these 26, 63% reported some sort of significant positive effect of the intervention. And Harvard Business Review goes as far as to say that patient engagement, or at least patient communication between caregivers and patients, has the largest impact on reducing readmissions. Some data from, in terms of using TWISTLE live, so the Advocate Lutheran Hospital in Chicago started using TWISTLE in February of 2016 as part of their perioperative surgical home model. And their early results have showed that, and they've implemented an enhanced recovery pathway. They've been using enhanced recovery pathway for a while, and ever since they started using TWISTLE, and again, take what you will out of this, they showed that their length of stay dropped by 30%. The number of unplanned 30-day readmissions dropped significantly, and what is most interesting, which I can't really explain, is that their wound infections also decreased. And as well, the data from Advocate Lutheran showed that the uptake was relatively high for all age groups. And quite impressively, actually, in the oldest population, still a majority of patients were able to use it. And patients, by and large, were very, very satisfied. Some direct quotes: "The staff prepared me very well before my surgery by providing appropriate written and video education." And this was, again, part of the TWISTLE, or at least some sort of a mobile app intervention. So now, again, I mean, the data is a little bit wishy-washy, and it's unclear exactly what the impact of this will be. But I think most people recognize that these things can be useful. But there are tons and tons and tons of apps that are out there. We're not sure which ones are the best. And as well, there are a lot of barriers in terms of they're not covered by insurance, they're not integrated with EMRs, and sometimes the cost has to be directly passed on to the patient. And as well, people are not sure, like, based on the number of apps that are out there, they're not sure of which ones to recommend, they're not sure if it actually is useful, and as well, importantly, the process is not in place for providers to recommend tools. And as well, in terms of the patient barrier, if you've ever had anyone try to install these on their phone, most people will say, "What's an Apple ID?" If they have an Apple ID, they'll say, "I don't know what my Apple ID is." And then if you actually finally get it on their phone, sometimes a lot of the apps, if you've ever used them, are not very user-friendly. So in summary, patient engagement is definitely the future. Apps are one part of the equation. The data in ERAS is encouraging, but it's very limited. And I think one of the key points to take home is that as of right now, the technology is still developing and underused, so we don't really know what the ultimate impact will be. Thank you.